right, here we go. Welcome to the channel, Anonymous MD, where we find the bias in science. And when so-called facts are shown to be fiction, take a moment to share, like, subscribe. We need to use evidence-based principles and counteract this recent epidemic of junk data. This data is basically being presented to the public as fact by the popular media, but it's really an assault on the scientific method, and that's a big purpose of this video today, to show you how the CDC, which is largely considered to be the main source of data in the United States, on which most recommendations are made, are really presenting very bad data, and knowingly so. So today we're going to focus on a recent study published by the CDC on February 4th, 2022. It was purportedly designed to test the effectiveness of various masks in preventing the contraction of the Omicron variant in California in December 2021. If you want to access the full article, you can see the link below. And I've also posted a link to another expert video that gets into much more detail about why any conclusions drawn from this study should be considered null and void. The reality is that the study had a plethora of flaws and biases, and we won't get into all of those today. Rather, we're going to focus in on one very simple principle that's integral in research statistics, and we're going to see how the CDC is knowingly presenting junk data from this study to the public. So this graph here represents one of the most basic principles that we learn about statistics, and that's the concept of statistical significance. We denote it with the character alpha, and we usually set it to about 5%, whereby alpha equals 5%. And what we're trying to do is say that the probability that a difference between the two outcomes was real and not due to chance alone. Or in other words, there was less than 5% chance that the difference we noted was due to chance alone. Every study has what's called a p-value that's reported and compared to the alpha. If the p-value is less than alpha or less than 5%, then it's very likely that the intervention being studied had a true effect on the outcome of the study arm when compared to the placebo. In other words, we reject the null hypothesis, and we state that the difference between the two groups is statistically significant. However, if a study reports a p-value that is greater than 5%, then any difference between the study groups is considered to be due to chance and not because of the intervention being studied. Or in other words, there was no true difference in outcomes between the study groups, and it was likely due to chance alone. This concept of statistical significance is compulsory in the scientific method and is the basic standard measure of causal effects on outcomes since at least the early 20th century. So study biases are one thing in that they're usually unavoidable and not intentional. And study biases are the reason why any conclusions drawn from a scientific study can't really be considered fact, but rather an opportunity to design better studies that ask more specific and focused questions in a continual process known as a scientific method to try to come up with the best plausible theories that we have for any clinical question. So physicians such as myself are trained to understand the various study designs, identify these biases, and gauge the overall accuracy and applicability of the findings. Again, the study was rife with biases, but that's not really the focus of this video. In our case, we're going to focus on the intentional presentation of data to the general public that reported on the effectiveness of cloth masks in preventing the contraction of Omicron compared to those who were not wearing masks. So in this paper summary, you can see that they're reporting what's called an odds ratio of 44% of the cloth mask compared to the unmasked. In other words, they're presenting to us a 56% reduction in the rate of transmission between the two groups in favor of the masked. Well, that's great, right? Well, here's the problem. There's no comment on the p-value, which is almost always included in abstracts and summaries, usually in brackets next to any reported difference between groups. That omission alone of the p-value would raise suspicion on the integrity of this study. Okay, so now we're looking at the image that the CDC tweeted out to present the study findings to the general public. So you can see that the cloth mask is showing a 56% reduction in the contraction of SARS-CoV-2 when compared to no mask, and this is consistent with the article's summary. But notice the really tiny asterisk that's placed there. if you look at the corresponding symbols in the footnotes, you can barely see that it says not statistically significant. In other words, we can't say that cloth masks had any efficacy in reducing the rates of infection when compared to the maskless, and any difference between the groups was due to chance alone. And yet, this junk data is still propagated to the general public and reported by the mainstream media as science. As a physician, we're always looking for the p-value of a study, since it's the most important marker of the accuracy of the findings. However, anyone unfamiliar with the scientific method would almost certainly miss the footnote in this image. And furthermore, the mainstream media does not reliably report on the flaws of a study, in this case, including the p-value associated with the different outcomes. So what's most disturbing to me about this paper is that the most basic statistical method that ensures the integrity of a study was disregarded, and cloth masks were falsely reported to make a difference in the article's summary and to the media at large. Yes, a footnote was included on the image, and by definition, that would make the observed effects of cloth masks on the contraction of Omicron null and void, and yet the authors still presented the data in this image to the general public on Twitter, and the footnote is so small that it's barely legible to the naked eye. I can't really think of any scenario whereby this disregard for statistical significance was not intentional, or at the very least, the authors and editors knowingly presented fictional differences as fact. Like I said, study biases are one thing in that they're unavoidable and unintentional and a consequence of the limitations of a study's design, but a total disregard for statistical significance when presenting data is an egregious attack on the integrity of science. The CDC knows that their conclusions will be propagated by the media and will likely be described as fact or the science. Fact checkers will use this paper to identify and remove misinformation on the web. Putting the several biases and flaws of the study aside, even if the study design was perfect, to present statistically insignificant findings to the layperson, I find is deceitful, unethical, and like I said, disturbing. Because of what I purport to be an intent to deceive, or at least by knowingly releasing flawed data to the public and media, this paper is more in line with propaganda than it is science. It begs the question, why would the CDC propagate the findings of a study that they very well know is poorly designed and inaccurate? For that, I don't have the answer, and here we don't talk politics, but it's something that we really have to think about. So thanks so much for sticking around for this video. Please remember to like, share, subscribe, leave a comment if you have anything to contribute, and I'll see you on the next one. Take care. Bye for now.